And we have a long ways to go.
We certainly do, yes.
Well, I'm hoping that we can concentrate on that because we have a lot more coming back. And that need is going to be very great. And the early intervention is the best approach to it.
Absolutely.
Are we finding that the general public is more aware of mental illness and more educated on its background and how it to be approached?
I think so. I think we've made enormous progress in educating the public about what these disorders are and that they are no-fault disorders. They're not caused by a lack of character, poor upbringing. But these are, at least in the cases of severe mental illness like schizophrenia and bipolar disorder, these are biologically based brain disorders. The treatments we have are more and more effective: medication, psychotherapy, other types of supportive services that help an individual really move toward recovery and independence in the community. So we've done a lot to eradicate, to bring about better understanding, but there's still stigma associated. There's still more that needs to be done to educate the general public about this.
And families. Is there a liaison that explains to families how the behavior might change and what perhaps to look for as symptoms?
Absolutely. NAMI has a number of signature education programs. One is called Family to Family, where we take families, really try and get them at first break, when the illness first appears, to educate the family members about what they're in for the course of this illness, and really educate them about how they can best help their family member.
And while they're waiting perhaps to enter into the veterans network of health care, which probably could be avoided in many instances if they had access to services at a local level in city or county facilities. Are we finding more awareness to that?
I think so, but we still have a long way to go. Even for public officials at the local level, they need to understand that these are serious illnesses with enormous public health burden, devastating consequences in terms of disability, lost work-life years, other types of measures we have to measure the burden of these illnesses place on society.
What kind of symptoms that a friend or family member could observe about a family interaction to call attention that there might be a problem when the family perhaps did not recognize it at that time?
Yeah, so the depression is probably the most common and prevalent mental disorder. And it's generally associated with not only just depressed mood, but lack of motivation, severe changes in diet, severe changes in sleeping patterns that are associated with sort of cluster of symptoms that we call major clinical depression. There's also, in the case of PTSD, another cluster of symptoms around severe anxiety disorders, irrational thinking about anxieties. Dr. Insel, the head of the National Institute of Mental Health, particularly in the case of PTSD, says that there's, on the one hand, normal reaction to abnormal circumstances, and people who witness severe violence, like in theater in Iraq and Afghanistan, there's going to be a normal course of coping with having witnessed that. What we really get worried about is when it persists for month after month after month, even years of anxiety, erratic sleep patterns, depression, and in many cases substance abuse that can accompany that. That's when we really get worried.
And how difficult is it for them to assess the care when those symptoms occur?
Actually, in a clinical setting, not that difficult. I mean, we have good diagnostic parameters and tools to diagnose these disorders, and we have treatments. It's really actually, and sometimes the biggest step is helping that individual get into treatment, be willing to participate in treatment, and quite frankly, accessing those treatment services, which can sometimes be very, very difficult.
Have you found that insurance companies, private insurance companies, cover mental illness now more readily?
They certainly do, and we have upwards of in excess of 95% of the health plans in the country offer coverage for mental illness and substance abuse. But we have a new law that, through your support, we're very grateful for your supporting this law, that was passed last year that will require health plans, starting on October 3rd, 2009, they'll be required to cover these disorders on the same terms and conditions as they do for diabetes, heart disease, cancer, asthma, etc.
Now, does that mean that Medicaid and Medicare will cover mental illness as well?
Well, there's a separate bill that your colleague Congressman Rangel got through that will bring parity to the Medicare program that was also passed last year. Medicare up until, well, actually still does, but starting in 2011 it will gradually go away, but actually required a much higher co-payment, cost-sharing requirement on the Medicare beneficiary for outpatient psychiatric services than for outpatient medical surgical coverage. So we fixed Medicare as well last year, which was a tremendous accomplishment, and we also did it for private sector health plans.
Mm-hmm. Is there a grading system that NAMI might do for the level of achievement for states and making sure these services are available?
We actually, this is the second time we've done it in the last few years. We released a report just a few weeks ago we call Grading the States, where we had a whole series of measures, up as many as 50 measures of the performance of public mental health systems. In Texas, it's the Department of Mental Health at the state level, but also your local MHMR centers in Dallas and Tarrant County in the Dallas-Fort Worth area, and measuring how they performed in delivering services to people with serious mental illness, and a whole range of measures, including access to supportive housing, access to employment services, access to medications, making sure they get access to the full range of medication treatments, case management services. We looked at how the state is performing and having the mental health system work together with the National Guard to serve people returning from Iraq and Afghanistan. The grades were not terribly encouraging nationally. The nation got a D. Texas did a little bit better than the national average, but we encourage you to go look at this report and look at how Texas did relative to the other states.
Mm-hmm. Well, Texas has had some fairly large institutions. Some run well, some run not so well. Yeah. And I really don't know at this time what kind of attention is being given to upgrading or improving those services. I do know that when we had the ruling a number of years ago that every patient had a right to treatment, if they weren't getting active treatment, they were discharged. Mm-hmm. And that's what created many of our homeless people.
That's exactly right.
I have not seen that diminish very much. So are we still seeing that same pattern?
Unfortunately, we are. And this was largely a failure to fund that community-based system that would help individuals once they were discharged from long-term state psychiatric hospitals. And we are still struggling enormously to get that system up and running and to get people the treatment they need and the support services they need, in some cases housing and other basic services, so they don't fall into homelessness. And when they do fall into homelessness, they generally get homeless and stay homeless for long periods of time. Mm-hmm. And we have a lot of data out there demonstrating that it costs Dallas and other large cities an enormous amount of money to keep someone chronically homeless.
Yes.
Because when they're chronically homeless, they're high utilizers of emergency room services, of inpatient care, the criminal justice system. You'll talk to many, I'm sure your sheriff in Dallas County can tell you, your police force in Dallas can tell you the enormous burden on their force having to intervene for someone with serious mental illness and sometimes a co-occurring substance abuse disorder who's in crisis. The enormous burden that places on the criminal justice system. So keeping people chronically homeless is actually quite expensive. And we have studies out there demonstrating that supportive housing costs about as much as it costs a city to keep someone chronically homeless.
Mm-hmm. And the other thing is when patients are discharged and given a certain amount of medications to take, many times they'll take that and not go for refills, and that's the beginning of them falling through the cracks.
Exactly, yeah.
Quite a few of them have already kind of let families slide if they've been institutionalized for a while. So is there a program that is supported or voluntary, whatever, to visit with some of the homeless? I just imagine that most homeless people need some kind of psychiatric care.
Many do, absolutely. And we have programs, models of care. There's one called assertive community treatment, where